So many Americans, probably almost every American, would be surprised to hear that, for example, these COVID-19 mRNA vaccines specifically are associated with an increased risk of appendicitis. They're associated with an increased risk of Bell's palsy. They're associated with an increased risk of shingles, which can be severe in some cases. They're associated with changes in sperm motility and sperm function and sperm count. And most recently, we're finding that they are present in breast milk, even though an earlier study published in the Journal of the American Medical Association reported that they were not in breast milk. And by the way, the reference for the increased risk of things like appendicitis and Bell's palsy, et cetera, comes from a paper that was published in the New England Journal of Medicine. So one of the things that I and other people did during the pandemic that distinguished us, we were talking about Dr. Bhattacharya earlier, is that we tried to be honest and we called things out when they were not honest. And in my role as the Surgeon General of Florida, you better believe that I'm not going to stop doing the thing I've been doing during the entire pandemic just because I'm in this position. No, I've continued to prioritize safety, honesty, straight talk, acknowledgement of limitations, and communicating what I think is in the best interests of the public. We've done a study. We've used a method called a self-controlled case series. It's actually a very powerful method. It's not one that we developed or anything, but it's one that's been used in hundreds of studies. Hundreds of publications have used this to evaluate vaccine safety, to evaluate the safety of other medications. The strength of the method is that it is self-controlled. So the huge problem with evaluating anything about the effectiveness or safety of any medication once it's outside of a clinical trial is that confounding is a B*TCH. It is just extremely difficult to identify unbiased, unconfounded estimates when something is deployed in the community and different people with different risk factors and different preferences and different behaviors choose to or not to take that medication. It is very difficult to tease out the effects of the medication from the effects of the confounders. The strength of the self-controlled case series is that you actually don't have that problem. People are their own controls. And what we've seen, what I saw on social media indicated that most everyone didn't understand the method. People were saying things about people's risk factors, for example. Well, it's self-controlled. So people's risk factors are accounted for in the model. People were raised other concerns about having another control group. No, it's self-controlled. You're actually looking at people and their own baseline risk and any incremental risk, benefit, or anything that increases or decreases risk associated with an exposure. In this case, we were looking at the COVID-19 vaccines. So the intuition of this method, and as I mentioned, it's been used in hundreds of studies, is that all you do, you look at people who have an exposure and have an outcome that you're interested in, and you assess whether the distribution over time of the outcome is random. In other words, you wouldn't think the exposure has anything to do with the outcome, or whether it's not random. In other words, perhaps the outcome is happening more after the exposure, or it's happening more later on. And what that tells you in this type of study design is whether the exposure changes the likelihood of a person experiencing that outcome. And that's what we did. And we found a number of different things. The COVID-19 mRNA vaccinations is associated with an 84% increased risk in cardiac deaths among young men. We had other findings such as, for example, an overall reduction in all-cause mortality in older people over the age of 60. and also an increase in cardiac mortality among men over 60. So they have more than one thing happening at once. But in young men from 18 to 39, it clearly was a signal for increased risk. So that was the main finding. This is not the first study to find an increased risk of cardiovascular adverse outcomes with the COVID-19 vaccines, specifically the mRNA COVID-19 vaccines. For example, there was a study that was published in JAMA Open, one of the sub-journals of JAMA, that looked at Scandinavian data, and there were a number of cardiovascular outcomes, primarily related to cerebrovascular disease, by the way, that also used the self-controlled case series model, that found increases in risk. The highest increase in risk, or one of the highest, was intracerebral hemorrhage after the Moderna vaccination. And that was an increase of 119%, believe it or not. And it's right there in the paper.
These are incredibly significant signals.
Absolutely.
Yeah.
The blessing, of course, is that it's not a common outcome. So in other words, even though the increase is profound, the event is uncommon. But there are a number of events. Coronary artery disease in that study also increased after one of the mRNA COVID-19 vaccinations. Other cardiovascular outcomes increased in risks. Another study was a study that was published in Nature's Journal of Scientific Reports. It found an association in Israel between the rollout of COVID-19 vaccines and acute cardiovascular events in young people. It's not definitive, but it's another piece of evidence. And then, of course, we've had a number of studies about myocarditis that show marked increases in risk. So there are a number of studies already. Actually, there's a fourth one that I should mention, which is a study that the FDA did, but has been very quiet in terms of their communication about, but it's actually available online. So the FDA has used Medicare data, and they found a signal of increased risk of acute myocardial infarction, in other words, heart attacks, specifically associated with the mRNA COVID-19 vaccines. So there are a number of studies that are indicating that these vaccines, mRNA COVID-19 vaccines, increase the risk of adverse cardiovascular and cardiac events. And we just added to that with another one.